Those who are here, can you please introduce yourself? In which year you are? Are you a practitioner or are you a young student? Which year of BHMS or MD you are in? Hi, Dr. Hitesh. Hi, Priyanka. All right, so let's begin. More people will keep joining in. Hello, Dr. Deepak Shah. Oh, it's a pleasure to have you. So it seems most of you are doctors here who definitely want to be a better practitioner. For that is the reason that you are all here. And that is the reason I am also here. Hello, Jitesh. Nice to see you here. Thank you so much. Okay. So the reason we have started this series of YouTube live sessions is, for one, I am a teacher and I enjoy teaching. And I want to make Organon very easy and accessible and clinically relevant. Because what happens is, hello, Sujit. What happens is that when I was a student, when I was a young student, and the idea of Organon that we used to get in our from our students, from our teachers, was that you have to clear the exams of Organon, but it's not clinically relevant. And hello, Ashish. Thank you so much. So we have started this session today. Fortunately, it's my birthday today, so it's an auspicious day. Vikram Samvat, Navratri, Gudi Parva, and my birthday. So it's a very good day to begin a new, something good. And so the reason was that I want all the practitioners to understand that Organon is not a book that you need to read only to clear your exams. Organon is a book that actually empowers you as a clinician. And to understand this, I need to share my story with you. Because without the context, no story works. Why I'm saying that Organon works in my practice and why others might say that they don't need it. So when I was a young student, like all of you, I fell in love with Organon with Organon actually before going to homeopathic medical college. There was some chance, some serendipity that I ended up reading Organon and I fell in love with Organon and decided that I need to pursue homeopathy as my career. Before that, I didn't know I wanted to be a doctor before that, but I didn't know what being a doctor meant, what cure was, what palliation was, what suppression was. So I entered into homeopathic medical college and there was a lot of theory about why homeopathy is superior, why allopathy is bad, how homeopathy cures, and how allopathy suppresses. And I was good in Organon, always getting the highest marks in general, also doing well in my career. But at the same time, the clinical training was very poor. So what happened was that, like what most of the students do, I started started trying to find a mentor. So I found a good homeopath, a very successful homeopath near my home, and I started assisting him. I had gone to him in my second year of BHMS, but by that time I had read Organon several times. So when I went there, I went with a lot of curiosity. Okay, this man sees 100 patients in a day. He has a lot of clinical experience. So let me learn from him. So I enter his clinic and he starts prescribing. I have a lot of respect for this person because otherwise he's a wonderful human being and very successful also. Uh, so I enter his clinic and then I start asking questions. Young students have a lot of questions. They are reading the theory, but they don't have a lot of clinical sense. They don't have a lot of clinical answers. So I enter his clinic and here comes a patient and here comes my question. Sir, why did you give this remedy to this patient? Because he was seeing 100 patients in a day, so he was using polypharmacy. So my questions were, so why did you give causticum and phosphorus together? It's written they are antidoting, they can antidote each other. Or next patient would come, so why did you give 30C potency thrice a day? Why not twice a day? What would happen if we give once a day? Okay, sir, what would happen if we give it 6 times a day? Why are you giving it TDS? What is the reasoning? What is the rationale? So you gave this patient tuberculinum before the treatment. Why did you give tuberculinum? What were the symptoms of the patient? The patient was giving symptoms of calcaria first, yet you gave tuberculinum first. In other patients, so why did you give medolinum at the end of the treatment? So why are you giving this intercurrent remedy in 200 potency every 15 days? What is the rationale for that? Why are you giving it in 15 days? Why not in 30 days? How do you know that it needs repetition in 15 days time? Other patient, so why did you give this patient 1 M potency? Why not 30 potency? Or why are you not using LM potency? Then in third year, I went to another homeopath, again very successful homeopath, very, very good human being. Again seeing 100 patients in a day, and of course again using polypharmacy, because there's no way you can do classical homeopathy with 100 or 150 patients in a day. So, but again I'll have questions. So why are you giving Berberis mother tincture? The patient is not giving any symptoms of Berberis. So why are you giving lycopodium if it's a right-sided renal stone? Why only lycopodium? There are so many other remedies for right-sided renal stone. So I'll have questions, a lot of questions. So when are you supposed to give a medicine if the patient has fever? Do we give it in the heat stage, or do we give it in the chill stage, or do we give it in the intermittent phase? So when are we supposed to give a remedy to a female? Is it good to give it before menses or after menses, or we can give it anytime? Okay, so now this patient has come to me and he's giving me symptoms of sulfur, but he has had an injury. Do I give him aconite or do I give him sulfur? If you have had these questions in your mind or similar questions in your mind, type yes in the comments. Let me see if you are all here. When you were students or even as young practitioners, have you had these questions or similar questions in your mind? I was a very inquisitive student. I had lots and lots and lots of questions. And the problem was that my teachers did not have answer to most of these questions. Most of the time, they did not have any rationale why they were giving tuberculinum 200. No reason. That is how they learned. Why they were giving a remedy in 30 potency TDS? No reason. They did not know what would happen if they gave it once a day. Or why not give it 6 times a day? They did not know why they were giving a particular remedy as intercurrent. Simply because their teachers had told them. But who had told their teachers? No answer. No answer. Why do you need to give Lycopodium and Berberis mother tincture for renal stone? No answer. Even if the patient is not giving symptoms of Lycopodium and Berberis, still 90% time you are giving Lycopodium and Berberis mother tincture. Why? No answer. And I'm telling you, these were very, very successful homeopaths. In fact, the two most successful homeopaths in my city, Jaipur. Tons of patients, tons of clinical experience. So when I confronted these homeopaths, I was told, Organon ka gyan ghar rakh kya karo, leave your organon knowledge at home. Clinically, the practice is done this way only. If your patient is coming with fever, you give aconite if the symptoms are of aconite, but you are giving ferrum phos 6x simultaneously. If the patient is coming with cough, you are giving bryonia, but at the same time, you are also giving biocombination number 6 or biocombination number 10. And that simply didn't make sense to me as somebody who had read Organon, who came into homeopathy because he loved the principles of Organon. That was the reason I came to homeopathy, and in practice I did not see any principle of Organon being followed, and that shook me. So there was a phase I did not want to practice homeopathy because it simply didn't make sense. I was a software graduate also, and I started working as a software engineer. My first job was as a software engineer. I started coding for a German company, but I realized that my heart was not there. So I soon left it and came back to homeopathy, finished my degree, and then I started practicing. Now here I am a young homeopath who starts practicing, who wants to do classical homeopathy because he's in love with Organon, he's in love with homeopathy, and he has had simply no training in classical homeopathy. The two teachers he assisted were both polypharmacists, and yet there was this desire to see those principles in practice. So what do I do? So when you open your clinic, young practitioners, what do you do? You buy all those medicines, and you buy a lot of other stuff also. You buy some mother tinctures, you buy some biochemic medicines, and even some common ointments like calendula and arnica and rustrox. You keep all of it in your clinic. I said, I don't want to do this. So I opened my clinic at the age of around 26, I believe, 25, 26. That was in 2001. So I opened my clinic and I did not buy any biochemic medicine, any mother tincture, any ointment. I never bought. Why I did not buy? I did not buy because I felt that if there was availability in my clinic, I might use them. If there was no availability in my clinic, there will be no way I will use them. If a patient with fever comes to me, there is no way I can give him China and ferrum phos together. I'll need to figure out whether this patient needs China or belladonna or bryonia or arsenic album or aconite. I'll need to individualize. There is no way for me to give him biocombination number 6 or biocombination number 10 or biocombination number 11 simply as a safeguard. I did not have anything to fall back. If a patient is coming to me for constipation, I did not have yellow tabs in my clinic to give to that patient. I need to figure out why this patient has constipation. If the patient is coming to me with a superficial skin allergy, I did not have calendula in my clinic. I needed to figure out the simillimum in every case, and here is where the fun started. Now the problem is that if you are not thoroughly clinically trained in classical homeopathy, practicing classical homeopathy is very, very painful. There are tons and tons and tons of failures. And that is how I started in my practice. More failures than successes, but that was okay. Even those few successes kept me in line. I kept reading my materia medica, I kept doing my repertory, I kept seeing my patients. But what happened was that the successes were intermittent, because I realized that a patient would come and I would give him a remedy, but what would happen after that, I didn't know. The case management was not there because nobody had taught me the practical part of the case management. So what I did was I kept working this way. I thought improving my materia medica would be sufficient, learning more rubrics would be sufficient. Nothing worked. Beyond a certain level, it helped me in treating a lot of patients, but nothing worked beyond a certain level. So what did I do? Like most of the young homeopaths, we start looking for more mentors, somebody to guide you. So I go out in the world and start looking for homeopaths to learn from. I end up going to Dr. Rajan Sakran. I read his books. I saw his case taking and clinical seminars, and I said, wow, this is how cases are to be taken. Nobody taught me. This is how classical homeopathy needs to be done. This is how a case needs to be opened. So I come back to my clinic very excited, and I start taking cases in such depth, which was missing in my practice earlier. Because what we were taught in clinic, even if you are a classical homeopath, there's a set pattern of questioning that you have to do. And that is how I was doing it. So I start doing a lot of in-depth case taking. But what happened was that I realized that despite that 1 hour or 1.5 hour of case taking, at the end there would be like tons and tons of data, lots and lots of symptoms, but I did not know how to make any sense of that data. Because to let the patient speak and get the data out from the patient is one thing, but to make sense of it in terms of finding the remedy, it's entirely different thing. So the struggle continued. I learned a lot of things from that school of thought, and but it did not lead to an internal satisfaction that I arrived. I can treat any case. So from there on, I went to Dr. Vijayakar, then to Dr. Sehgal, then I ended up reading Sholton, then I read Jeremy Sher, and with all of them, I improved a lot as a clinician. I learned a lot, but still something was missing. And what was missing was what we call a neve, the grounding. And that grounding was that still the part that classical, there was different schools of thoughts, diverse opinions, and at times a particular case will be held by a particular approach, or a particular other case would be held by other approach, but there was nothing binding it all together. And the clinical success was still limited, because the questions that I had when I was a second year student or a third year student, most of them were still unanswered. So then I came back to Organon. I started reading Organon again from the clinical point of view. Like, this patient is coming to me, how do I treat him? What are the guidelines in Organon? If I have to give him a particular potency, what potency do I need to give him? What is written in the Organon? And then I started reading people who are masters in Organon, like Luke de Schipper, David Little. They became my gurus. And I started following their work. And suddenly, the bulb came up. The lights came up. I realized I found the binding principle, and the binding principle was Organon. My practice skyrocketed because I was very sure of what I was doing there. I knew when a case was coming to me, how do I take a case? It's not so simple when you have a patient who is 6 months old, or a patient who is 2 months old, 2 years old, or a patient who is 80 years old, or a female who is perimenopausal, or a case who is in adolescence, a patient who has psychiatric illness. They all need different approaches for case taking. And the good thing is everything is given in the organ. In Organon, you find if you have a one-sided disease, how you treat it. If a case is coming after a lot of allopathic medication, if a case is coming after a lot of suppression, how do you treat it? If a patient is coming with psychiatric illness, how do you find out if it's a true psychiatric illness or it's a one-sided disease? And if you find that it's a psychiatric illness, how do you treat it? How do you find what is PQRS in a psychiatric illness? A lot of questions got answered with Organon when I started reading Organon from the perspective of clinic. As a clinician now, when I was reading Organon as a second year or third year student, I was reading it as a theory. I was enjoying it, but it was only theory for me. But when I started reading in context of my patients, okay, now this patient has come to me, he said this, that this disease happened after this disease happened after this disease, then I could actually correlate. I started correlating. What is it he's saying in terms of Organon? Where is this written in Organon? That this progression of disease happens in this way, and how do I treat it? If I'm treating just 5 days back, a patient, an autistic patient who was also hyperactive, I gave him a certain remedy. The patient called later that from United States that I gave the remedy to the patient. He became more hyperactive. I stopped the remedy, and the patient is much better. Earlier, I could not make any sense of it. What do I do now? Do I repeat? Do I not repeat? Do I antidote? What do I do? But now I know if the patient is saying after giving the remedy, the patient became more hyperactive, he did not give it the remedy, and now the patient is feeling better than before, then I knew that my remedy was good. This was a homeopathic aggravation that the patient observed, and the patient is improving, so I do not need to repeat the remedy now. So you need to have this understanding of concept of homeopathic aggravation or medicinal aggravation or disease aggravation to actually manage those cases, to understand whether this is a medicinal aggravation or disease aggravation or a homeopathic aggravation. And that will actually decide your follow-up. What do I do? Do I wait and watch? Do I give him another dose of the same remedy? Do I increase the potency? Do I decrease the potency? Do I change the remedy? Do I antidote? What do I do in those cases? And this applies to every single case. When you're reading Organon, you actually start learning how to listen to the patient. It's not enough when the patient is saying when you are, because most of the patients are lost not during the first consultation, they are lost during the follow-ups because we are not able to manage the follow-ups. The patient, you do your level best during the first consultation, but you will not be able to find the simillimum every time during the first consultation. Now, when the patient is coming to you after the first consultation, during the first follow-up, and he's telling you, sir, this has improved, this has not improved. This particular symptom is better and this symptom is not better. What sense you are making of it? You cannot make any sense of it if you do not know Organon. You need to understand if the patient is saying, sir, my migraine is better, but I'm not able to sleep since you gave me your remedy. What sense are you making of it? He is saying the migraine is better, but his sleep is actually worse. So this type of clinical knowledge, clinical decision making, you can only acquire if you understand Organon from the point of view of a practitioner, not just as a book of theory. And that is actually the magic of Organon. If Organon is read as a practical tool, then Organon has a lot to give you. I still remember reading Adolphe Lippi, one of the most famous homeopaths of all times. He used to read Organon every year, even after like 30 years of practice. And every year he used to say that every time I read Organon, I find something new. And that was his personal advice to every homeopath too. That even if you become a successful homeopath, read Organon at least once a year. Not because it's a religious book. It's a scientific book. It's a very scientific book. But to actually understand what you are doing to your own patients, you need that grounding. You need that anchor that only Organon provides. If a patient is coming to you, say a 6-month-old child is coming to you, of course with the mother is bringing the child, how are you going to take that case? The patient is not saying anything, and yet you need to take the case and you need to prescribe the remedy. Where do you learn that art? That art is given in Organon. What potency do you give to that child? You'll say, okay, young child, 30 potency. Why 30? Why not 1M? What would happen if you give 1M? You might say, I'll give LM potency. Why LM? And if LM, which LM will you start with? It will be 0 by 1 or 0 by 2 or 0 by 3. And if you have given, suppose you gave this child, say, Calcarea Carb 200, and the mother comes to you in 5 days' time and says the child is better, slightly better. Now, what are you going to do? Do you repeat Calcarea Carb 200 again? Do you increase the potency to Calcarea Carb 1M? Or do you decrease the potency to Calcarea Carb 30? What are you going to do? Do you know what Hahnemann used to do? Any ideas? Anybody who knows what Hahnemann used to do, can you type in the chat box, in the comments? Any idea, anybody? Did Hahnemann ascend with the potencies or did he descend with the potencies? We are usually taught that you have to ascend. Is it? But Hahnemann did not used to do this. When he was practicing with centesimal scale, he would often descend. But you don't know. And why you do not know? Because you haven't read Organon. You haven't read the philosophy part well. You haven't actually gone to research the case books. It depends upon the susceptibility. Definitely it depends upon the susceptibility, but how you're going to measure the susceptibility? Again, that's not a practical way. The susceptibility of the child doesn't change in 5 days. Huh? So these are practical decisions that one needs to make in clinic every day with every patient. If a patient is coming to me and he is on anti-epileptic drugs, do I take his case or do I not take his case? Do I ask him to taper the medicine or do I not ask him to taper his allopathic medicine? He is showing a lot of side effects of the allopathic medicine. Do I include those symptoms in my anamnesis or do I not include those symptoms in the anamnesis? Where is the answer? The answer lies in the Organon. Hahnemann has written everything about this. If a case is coming as a complex case with a lot of allopathic medication, a lot of side effects, then how do you treat that case? Hahnemann has given the answers. Hahnemann has given the answer how you have to take a case, whether it's a child or it's a pediatric case or it's a adult case or a geriatric case. It's written in there. Hahnemann has told you how you have to measure the sensitivity of the patient or the susceptibility of the patient. Hahnemann has written how you have to select the potency according to it. Hahnemann has told why you need to ascend and why you need to descend. When you can ascend, when you can descend. Hahnemann has told very clearly in Organon how to make sense of patient reaction. You have all read Kent's 12 observations. They are wonderful. But the direction of cure of Herring or the 12 observations of Kent, they are not originally theirs. What you say is Herring's direction of cure or Kent's 12 observations, they are all given in Organon. It was all Hahnemann's work. Yes, tapering home allopathic medicine is a tricky affair in psychiatric cases, but it can be done. But there are guidelines for it. There are ways to it. And that is why it is very important, it is very pertinent that you learn Organon, and not just as a book of theory. You would have read in Organon what happens when two similar diseases meet in the body, or what happens when two dissimilar diseases meet in the body. Or you would read in aphorism 63, 65, 66, 67 about the primary action and the secondary action of the drug. What are you able to see those things in your practice? When you are giving a particular remedy to a particular patient, is this the primary action of the drug or is it the secondary action of the drug? When you have to give an antidote to a particular patient, okay, you gave a remedy, it doesn't work well, and you think, okay, I need to antidote this remedy. So how do you antidote this remedy? You open the Boric or the Relationship of Remedies book by Rehman, and what do? You come to the particular remedy that you have given and you look at the column for the antidotes, and from those antidotes you give a remedy. You don't realize, you don't ask yourself why this remedy is an antidote to this remedy. Why causticum is an antidote to phosphorus. Why belladonna can antidote stramonium. Because that why is actually in Organon. The philosophy that is written not just in Organon, but also in the chronic diseases, and also in the lesser writings of Hahnemann. A lot of good details are there about case management in chronic diseases also, and in the lesser writings of Hahnemann also. So Organon is not the only book that needs to be read, but Organon is the first book that needs to be read, and it needs to be understood. So when I started teaching when I opened my clinic, the same year I started teaching also as a lecturer of Organon of Medicine. And so when I started teaching, what I did was that when I'm teaching a particular aphorism, I'll bring case examples. That this is the aphorism and this is how you see this aphorism in practice. This is where the patient is saying, you are saying that this is primary action, this is secondary action. Let's see a video and see, or give another paper example that how you see a primary action or a secondary action. How do you differentiate between them? If we are talking about posology in a particular aphorism, I'll bring cases. Okay, this is how the patient's sensitivity and decides the posology. If we are talking about follow-ups of the case, I'll bring relevant aphorisms. Okay, this is written in Organon, this is what we are doing in practice. And when I started doing this, it gave me a lot of confidence as a teacher also, because I had answers for most of the questions I did not have when I was a student. And I also, just like Adolphe Lippi, even today when I read Organon, every time I read Organon, I am just amazed at the insights that Dr. Hahnemann has left for us. I don't say that Organon is a complete work. There were 6 editions of Organon, and for the reason that it's a scientific book, and science needs to progress, and as science progresses, books also change, they grow. But the problem is that even after 200 years, we are still not fully able to utilize what Hahnemann had written. You can only build upon what Hahnemann had written once you have actually understood what Hahnemann had written yourself. You can only reach level B once you have reached level A. The problem is we have not even reached the level A of Hahnemann. We are doing better as homeopaths. We have a lot of remedies. Hahnemann had only 100 remedies. We have 4,000 remedies. Hahnemann had very simple repertory that he himself created. Today we have repertories with 10 lakh rubrics, synthesis, complete. We have repertories for every part in the body. But are we able to make sense of all that data? Are we able to somehow make sense of all the different schools of homeopathy? So, because of all these reasons, I believe that Organon is important for every homeopath. So, once I started teaching, I started writing also. So then I ended up writing books from the clinical perspective, teaching Organon uh, from the perspective, from a very modern perspective, with lots of case examples in easy language. So I wrote 3 books after that, which are published as lectures on Organon of Medicine. You can see them behind. Uh, these books are now part of the CCH syllabus for both BHMS and MD Home, and they are available at Amazon and Flipkart and even my website. And so the books became a method for me to make my knowledge, make my understanding of organ reach to everyone. But again, books have their own limitations. What live teaching can do, books are essential. For the groundwork, books are essential. You cannot do away without the books. But the real fun is when you see live cases, when you see somebody explaining aphorisms with a lot of live examples, then it's more fun. And that has been my desire, and that is why the series of uh, YouTube lives and Facebook lives have started. And I'll try to cover a lot of interesting sessions in future, a lot of interesting topics in future. For this session, this was an introductory session where I've shared my own journey and the reason why I feel that learning organs is important for clinical success to become a master prescriber. You cannot become a master prescriber without having mastery over the organ, without having mastery of the philosophy. For next sessions, I would like to know your suggestions. What are the topics you guys are interested, you people are interested in? And if there are any questions that you would like me to answer, please go ahead and share them on the chat box. Okay, so you say your health with homeopathy says that at times you get confused and at times you have this eureka moments. Uh, there are reasons for that. We get confused with Organon primarily because of the language. The language of Organon is still the Shakespearean English. It's not easy to understand. And that is why I wrote my books, Lectures on Organon of Medicine, to actually bring the knowledge of Organon in a very easy modern language and very clear case examples. It's confusing only if you do not read cases along with it. And the eureka moments, even I get eureka moments even now, even after I've been teaching Organon since last 21 years. And even after teaching for 21 years, both undergraduate and postgraduate students, I still, every time I read Organon, I have eureka moments. I feel, okay, how could I miss this particular thing for so many years? It's so rich. It's so rich that every time I read Organon, I bow in front of Hahnemann for the wonderful information and knowledge that he has shared, the wisdom that he has shared. And I feel that there is a lot we can learn as homeopaths from Organon. Your knowledge of materia medica is important. Your knowledge of repertories is also important. But materia medica or repertory helps you select a remedy. It doesn't teach you how to manage a case. It doesn't help you with posology. It doesn't help you with follow-ups. It doesn't help you with antidotes. It doesn't help you with case management. It doesn't tell you when to prescribe a remedy, at what time to prescribe the remedy. It doesn't teach you when not to prescribe any remedy. All this information is required for case management. Without the case management part, most of your cases will not succeed unless a very superficial case with high vitality, you give a particular dose and the patient gradually improves on its own. These cases are not very, very frequent. Most of the patients who come to me or to most of us as homeopaths, they are all chronic cases. They are inveterate cases. They have been taking medicines and drugs for so many years. Sometimes they come to me with other homeopaths. They have already taken 20 remedies. They all come to me with allopathic medicines continuing, several medicines continuing. Most of these cases are not such that you give them one remedy or a couple of doses of a remedy and you have a miracle cure. That doesn't happen in most cases. You need a lot of understanding of patient management, case management, follow-up management, to actually treat those cases successfully. Because what happens is that if a patient is coming to me with a particular disease for 15 years, and I suppose I start treating him from rheumatoid arthritis, I am giving him a particular remedy, and in 6 weeks' times the symptoms change. Now, some symptoms change, some symptoms do not change. What do I do? Do I give him the same remedy? Do I give him another remedy based on the new set of symptoms? Do I change the potency? Do I give him placebo? What do I do? In another 6 weeks, the patient comes up with totally new set of symptoms or gets an acute. What do I do? Continue with the same remedy, give him an acute remedy. What do I do? And what if that acute remedy is listed as an antidote to the chronic remedy that I have given? Should my patient take coffee during the treatment, or should he not take coffee? Do I restrict any dietary, do I give him any dietary advice, or do I not give him any dietary advice? Does he need to abstain from all the medicinal foods like garlic and cardamom and so many things? So these are the questions that can only be answered from Organon, not from repertory, not from Materia Medica. So whatever school of thought you are following, I'm not against any school of thought. You might be following Dr. Sankran, you might be following Dr. Sehgal or HHF, which basically is Dr. Sehgal's method, and or you might be following the Calcutta school of thought. You might be doing any other approach. All these approaches work. They are like some people are identifying the elephant from their trunk, some are identifying from the tail, some are identifying from the leg, some are identifying the elephant from by holding the ear. But a good practitioner is one who can identify the elephant by the tail, but at the same time, if need be, can see the whole elephant also. So that is where classical homeopathy comes in, which can bind all these approaches. That if a patient is giving me this particular symptom, I can identify the remedy by the desire for light also, or from libertinism also, or I can identify the remedy from his kingdom approach also, or I can identify the remedy from the PQRS that the patient is giving. So these are different approaches. Ultimately, they lead to the same remedy. A patient doesn't have many similimums. Your approaches can be many. The similimums are not many. If you have to cure the patient, you have to actually come back to the same remedy. So this is what I feel is the reason that it is important. And are there any questions? How much small a dose should be of selected potency, 4 globules or 1 globules? So this is a question that has been asked. What is the dose? Now, Hahnemann in Organon has used dose in two terms, two contexts. One is the quantity of the dose and one is the quality of the dose. In both places he has used the word dose, but he has been very, very clear in terms of quantity of dose also. And he has said in Organon that the dose should be the least possible. Least possible in terms of quantity. That means if 1 pill is sufficient, you do not need to give 2 pills. For Hahnemann, 4 pills was too many pills. Hahnemann used to use only 1 or 2 zero-size pills or 10 number pills at most. And they are sufficient because even when you are using 50 millisimal scale, that is what you use. Even in centesimal scale, if you are using water-based solutions, that is what you use. 1 or 2 medicated pill is sufficient. And you need to understand this also from the perspective of philosophy. You are not giving anything material in 1 pill. So it doesn't, why do you need to give 4 pills? Why? What is the rationale? At least the rationale for giving 1 drug is that the less is better. But the 1 pill, there is no material dose in there, it's energetic. So why do you need to give 4 pills? If one pill is sufficient, then one just give 1 or 2 pills. The less, the better. That is the criteria. That is how Hahnemann used to practice. So potency and dose, Akshay, these are very large, complex topics, and they need webinars for full day. I'll try to cover these sessions, these small sessions. A lot of information regarding posology and dosage part, when to give, when not to give, whether to give, with scale, when to use with scale, and when to ascend with potencies, when to descend with potencies. This needs a lot of data that needs to be shared, a lot of history that needs to be shared, and I'll do in the forthcoming webinars or live sessions. Any other questions from your end? All right, no more questions. What other topics you would like me to cover in the next webinars and the next live sessions? Please type in the chat box. What are the topics of your interest? What are the areas where you struggle as practitioners or students? When are you writing book on the chronic disease by Hahnemann? It's in my to-do list. When it will see the day of light, I do not know. I haven't started writing it yet, but it's there in my mind. I've done a lot of research work related to miasms and how the concept came into being and how it can be used in the current scientific understanding that we have. And miasms is a very scientific concept that can be understood uh, in modern medicine terms also. I'll try to cover that. The book, I don't know when I'm going to write it, hopefully someday soon. How to manage follow-ups, potency and Bhavnesh, I've already said that potency and dose selection there. I'll cover that part in the follow-ups sessions. And Hardik, I'll take care of the follow-ups also. How to manage follow-ups. Bhavnesh, the book on miasm is going to come, but when I do not know. Surjit, the follow-ups, I'll do the follow-ups part in the next webinar, in the next live session. If you have any other suggestions, how to manage, Tariq is asking how to manage dose repetition in terms of LM potencies. Sir. So, okay, I'll do a session on LM potencies in detail, where I'll cover only LM potencies. I'll have a session one, at least one session only on LM potencies, because this is a scale that still many people find it very difficult to use. And there are a lot of myths related to LM potencies. Like a lot of people say that LM potencies do not have any aggravation, which is actually wrong. Thank you, Hardik. Thank you so much. Pediatric cases. Okay. Yes, I can teach you how to manage pediatric cases. Just for your information, although I'm a teacher of Organon, but I did my MD in pediatrics. So I'm MD pediatrics, and I see a lot of pediatric cases, a lot of autism cases, a lot of dyslexia cases. So a lot of my practice is on pediatric cases. So I'll share those also. How to approach pediatric cases. Anything else that is of your interest that you would like to learn, go ahead and share. And even after today's live session, if you have any doubts, if you have any inquiries, if you want me cover any particular topic, you can drop me an email at my email ID Manish Manish @hpathy.com, hpathy.com. Susceptibility, okay, Priyanka, we'll do a session on susceptibility and sensitivity also. Bhavnesh, I've already said that I'll take care of the pediatric case taking. I'll teach you how to take pediatric cases. It's fun. If you have like a three days old child, how do you take the case? So that it's fun actually. A lot of challenges there, but yes. Hi Milan from Bangladesh. Milan, I can only say that you do not need lots of books. I do ask you to read Organon, and if you can get, although it's not very ethical, but I still say that if you can get these Organon books in your country, I'll be happy to provide if there is a supplier there. I don't have anyone there in Bangladesh. They are available in most of the Western countries, but not in Bangladesh. But I'll be happy to supply them there. You can get these books, and they will actually help you read Organon a lot, very easily, with a lot of good case examples, modern terminology, scientific understanding, which is what often Organon books lack. And so you can begin with Organon. You can start with my books on lectures on Organon of Medicine. You need a good repertory and you need some good materia medica books. This is how you begin, Milind. And as you progress, there are always more and more books to read. My book's name is Lectures on Organon of Medicine. It comes in 3 volumes, Volume 1, Volume 2, and Volume 3. It is available at Amazon and Flipkart and my website, drbhatia.com. And I've already said that you can get them from Amazon or from my website, drbhatia.com. It's available on many bookstores also. Yes, in India. Or if you are not able to find them somewhere, if you want them to get a signed copy, you can write to me. You can write at books@drbhatia.com for any inquiries related to books. Books@drbhatia.com. So primarily, okay, I'm recommending these books, but this idea of these live sessions is not to promote these books per se. The idea is to share my knowledge. I love to teach Organon, and that is what I want to do. You can read any book that you find interesting. You can read any good translation of Organon. If you can understand that English, and if you do not need any supplementary book, the book by Hahnemann is sufficient. So this is it. I believe this is all we have time for today's session, because this was an introductory session. Hopefully in future sessions we'll have more time and more people joining in to make it more lively and more interesting with more interaction. I'm really thankful to all of you for joining in today, and I look forward to your presence again in future sessions. Thank you so much. Thank you, Tariq. Thank you so much. So we are ending the stream now, and I look forward to seeing you again.